Breaking news here, Kevin Hawk, Morgan Whaley, joining us here on the scene of Population Health Equity Research Institute and Center for Health Equity Engagement, Education and Research, Cheer News. I have a few questions for you, Morgan. What is your health equity research origin story, and how did you get started in the work, and what is your why?
Well, I studied public health when I was in school,
Mhm.
and some of my favorite classes were the ones that were cross-listed with sociology and anthropology. The reason I like those classes is because we got the opportunity to actually read about people's lived experiences in regards to their health. And I guess that also connects to my why of why I enjoy doing this work and why I do it is the fact that it centers the voices and the experiences, but also the wants and needs of community members. Um, yeah.
Perfect, thank you. And second question, if you could have one superpower, Morgan, to help achieve health equity, what would that be?
I would say, in terms of my role in the work I do in trying to achieve health equity, um, I think a great superpower for everyone in our department to have would be to know when everyone's calendar is free. I just automatically know, yes, automatic time, everyone is available to meet.
Great response. And lastly, if you had to name a health equity villain, what would it be?
I would say maybe there's so many, but if I had to pick one, I would choose housing segregation policies of the past and present because I think a lot of health disparities we face are rooted in our location, in where we live, in our physical environment. You know, there's a reason certain people live where they do and can't live other places and all that good jazz. So I think that's, for me personally, I think that's something that's um, very, very grounded in the root of health inequity.
Thank you, Morgan, for that informative response. We appreciate you for taking the time out on the streets of Cleveland to just bring some awareness to breaking news with health equity.
I would say it goes back to my upbringing. My roots in health equity research stem from my experience in growing up in a marginalized community in Burkina Faso, where I witnessed the inequities in access to health care. These experiences fueled a passion for social justice, which has in turn fueled my education and career in public health, particularly in health education and disease prevention. As to my why, it is to create a world where all people, regardless of their background and circumstances, have equal opportunities for optimal well being and health care.
I started my interest in research around both diabetes and health equity in residency when I was seeing patients in the Bronx, and mainly Hispanic and African American low income patients, and so really saw a lot of issues that they couldn't access healthcare, or if they accessed healthcare, they couldn't get what they needed due to cost, or they ran into bias issues and weren't getting the care they needed. So that's probably where my desire to try and improve care for all of our patients that we were seeing really stemmed from.
All right, thank you for tuning in live in Metro Health. And I do have Dr. Thur that's going to answer this question.
My origin story is I'm someone who's very interested in environmental health. And so in my research work, I have always, time and again, studies after studies I've come across show that environmental pollution is higher in certain communities compared to other communities, and often where communities where pollution levels are higher, such as air pollution or water pollution, are often in low income communities, communities of color, the elderly, or people with disabilities. And so I realized that, when you talk about environmental health, you have to address the issue of equity. And so that's how I got into this research and what motivates me.
Nice. Thank you for that. Thank you for your response. That was very informative.
Here with Carrie Gibbons from Northeast Ohio Coalition of the Homeless.
My why is I started my roots back when I was employed at the LGBT Center of Greater Cleveland. And I just kept seeing time after time the disparities amongst trans folks when it came to healthcare. And as I was able to learn through the Chrissy Scholar Initiative more about research and community engagement, being able to be a participant that is a part of the community and participate in the research in a way that is person-centered is my why. Because we want the voices of those who are going through the experiences to be at the front of the conversation and leading where things go. And that is my why.
Here with Maeve McMurdo. How did you get started in this work? What's your why?
So I do occupational environmental health, and it turns out that you don't have to get very far into occupational health to start getting really, really mad about health equity. So it turns out that where you work is probably one of the biggest drivers of what happens to you health-wise, and where you work also impacts the community around you.
Yvonne Oliver with Stewards Caring Place. Nice to see you.
Well, this is really interesting because I actually got started about 20 years ago with tobacco reduction, where we did research going into places looking at the harm that smoke was causing in the workplace. So I moved from that cause, which was very interesting, to another one that had to do with high blood pressure among African Americans. And somewhere along the way, I was diagnosed 2 times with breast cancer, one in each breast, which led me to my current interest in research now. Oh, and I don't want to forget the big one is working for a statewide healthcare advocacy organization that really was the organization that I came into, the Community Research Scholars Initiative, affectionately known as CRISI. So I've been involved in some form of health equity and advocacy for a very long time.
I would love to have a shield that gives folks the ability to feel full of not only grit and resiliency, but also like love, care, and compassion inside themselves, so that when we all come to the table, we are full and we're able to bring our whole selves.
And if you could have one superpower or two to help achieve health equity, what would it be?
Thank you for saying 2, because I need 2 superpowers for this. My first superpower around this would be just being able to give people money so that everybody had enough money to live on. So that would be a really great superpower that I could give to other people. But I think there's so many other pieces in just how we set up different structures that impact how people experience both health and health care, that my second superpower, maybe it's too broad, would be to sort of level all those structural differences so that they're all evenly keeled, so that we don't have that imbalance to start with.
And for our second question, if you could have one superpower to help achieve health equity, what would it be?
I think you need many different superpowers, but one that I think is relevant to my research that I would like to see is for me to be able to switch all our energy systems from fossil fuel to renewable energy, like wind, solar, geothermal, just away from fossil fuel, because that is the beginning and the cause of all the environmental pollution that we see today.
I would name predatory landlords who don't believe housing is a human right?
As to this question, I would say, like, in a realm of health equities, for me, it will fall under the category of systemic racism. Systemic racism operates in within institutions, policies, and practices that creates disparities in health access, qualities, and outcome on the basis of race and ethnicities. I think that there are forms of systemic racism, from implicit bias to an unequal treatment and restricted opportunities for marginalized groups.
Well, health equity villains would have to come in the form of capitalists who run insurance companies, hospitals, and are in it strictly for the profit.
And if you had to name a health equity villain, what or who would it be?
Can I say capitalism, or is that not an appropriate answer?
I feel like it's fine.
In that case, capitalism.